I've been in public health over 20 years. My passion for public health began when I was a Peace Corps volunteer in West Africa, Cameroon. I worked as an agroforester, but I was really introduced to vaccine preventable diseases, enteric diseases, communicable diseases, in particular HIV and what was happening in Africa at that time. So my passion for public health started as a Peace Corps volunteer. And then I was lucky enough to be able to come back to the United States and find my way into local public health.
So yeah, you've definitely had a background with that. So over those 20 years, I imagine you've never faced anything like COVID, or maybe you have.
So that's a really great question. For public health practitioners, all of our education, whether we're going to conferences or doing continuing education or taking formal classes, we've known that a pandemic is something that's going to happen. We always said it's not if, it's when. I'll be honest, I really never wanted it to happen while I was in my profession.
So what was that like once it hit? Was that kind of like an uh-oh moment, or was it like game on?
So we've had a couple of pandemics that, so MERS and SARS, and as public health practitioners, we were watching those closely a number of years ago, as well as H1N1, and they did not materialize to the magnitude of COVID-19. So as COVID-19 was beginning to show its face around the world and around the globe, I was thinking to myself, well, let's hope this looks more like MERS or more like SARS, or I'd even take something like H1N1, but as we all know, this pandemic was of the magnitude that we never hoped to see.
So then from like the health department standpoint, how was the leadership from you, and then the overall department as well as the county executive?
Yeah, so I will start with the county executive's leadership. When we began having conversations at the end of February about the magnitude of the COVID-19 pandemic, she was 100% supportive, and she really basically embedded herself in the health department, which was so incredibly helpful. It showed her leadership to the staff throughout the department. I felt confident and comfortable with someone sitting with me through this, making decisions that we were faced with making that never had been faced before. And so we really joined together and took this on. I can't be more impressed with the leadership along the way. Internally, my staff, internally the Erie County Department of Health staff, they stepped up like no other. Their passion for public health has been shining through for months. We're tired. We're losing steam and energy, but I know the reason each one of them get up every day and come do the work that they do is because they care about the people and they're passionate about it.
So what's one thing, I guess, top list that you guys are most proud of that you implemented prior to everything, I guess, really blowing up with the pandemic?
I think the first thing that the first thing we're very proud of is we've practiced and we've drilled and we've studied what's called the incident command structure. It's the National Incident Management System, and we used it. And while we're not super effective or super familiar with it, we said we need to use this. We knew that the pandemic was going to expand, and we needed to have some sort of span and control over the project and what our response was going to be. The second piece of this is everyone just stepped into COVID-19 regardless if it was their expertise. Everyone from the environmental staff, nursing, health educators, administrators, managers. We said, we don't know much about this, but we're all gonna jump in and give this a real try. Very proud of that. And then the third thing would be health equity. We are watching across the country that vulnerable populations, communities of color, Black communities, new Americans, English as second language, were really being hit hard with COVID-19, and their outcomes were very significantly worse than others. And we took that as a priority project before we began to see that in our own community. And we're very proud of the work that's happening there, and will continue to happen.
And then I imagine, obviously, there were some obstacles to overcome. So talk to me about some of those that you guys faced.
Yeah, so our obstacles are probably significant, but I'll be honest, I don't think about those as much as I do the positives. So I think staffing, having enough staff to do the work. I look back and the hours that we've been putting in is really unfair to staff. We have a plan moving forward using some additional funding that would be coming out of the CDC to hopefully augment staff at least throughout the response. Big challenge. Communication has been a challenge. We always know communication is a challenge. I've heard people say, you know, maybe you did such a good job early on that then people started to think that, oh, it wasn't as big of a deal or it's not a big a deal. So they've maybe not been as responsive to the messaging. And then third is really how do we, what's the long-term economic impact? And public health is realistically, we advise on public health and health outcomes. We do things from a traditional disease perspective. I'm not trained in economy. I'm not really trained in politics. So to pull that three-legged stool together and say, what's the balance? I don't necessarily know that I have the core competencies for that. And that's been a big challenge. And I think you've probably seen that across the country.
And then my last question really to close out, obviously we go to medical professionals and we look to them to be that guiding light, but it seems like at some point during the pandemic, people started to kind of turn away from health professionals. So what has that, I guess, been like faced with that or people who are in denial of the whole pandemic?
So I can understand that the messaging has been very confusing, and the messaging coming from even the medical providers and medical professionals and public health professionals has been conflicting. And it's been conflicting over time, and a lot of that is because we're learning about COVID-19. Do we mask? Do we not mask? What's the transmission rate? What's the death rate? What's the positivity rate? And so I'll be honest, each professional is giving the appropriate information at the time that they're giving it based on the information that they have to be providing a response to the question or the activity. That's been very hard. But I would understand why individuals then begin to say, it's hard to trust what they're saying because it changes. But in a pandemic, we should expect that the information is going to change. And each time we're giving new advice and new guidance, it's because we're doing better and better every time.
And then moving forward, hopes, wishes for Erie County.
Can you repeat that one for me?
Yeah, just moving forward, hopes, wishes for Erie County as we move through this green phase into whatever's next.
Yeah, so I know everyone in Erie County is very excited about going into the green phase starting tomorrow, Friday the 26th. And I'm happy that we were able to do this together to get to a place where we can go into green. My hopes and my expectations is that everyone continues to remind themselves and remind others that we're still in green, and green is not going back to normal, it's going to the new normal. So we have to continue to mask, be very cognizant of how many times we gather with people, staying as physically separated as we can so that we don't spread the disease. The disease is still very much present, and we just need to work together. But I'm confident that Erie County and the residents and the business owners, we can do this.